My name is Terry Mamounas. I'm the medical director of the Comprehensive Breast Program at Orlando Health Cancer Institute in Orlando, Florida. So the question of whether all patients that will undergo a lumpectomy should have a breast MRI is actually an important one, as a breast MRI is used more and more in early stage breast cancer. And the short answer to that question is that not everybody that will have a lumpectomy needs a breast MRI. There are patients that have very well-defined tumors, very fat-replaced lymph nodes. The tumors are easily visible by mammography. We don't see any other density in the breast. That particular patient, for example, would not need a breast MRI because you can easily assess the extent of the tumor by just mammography and ultrasound. But there are situations where a breast MRI can be useful, and those situations involve patients who have either dense breasts where you can see the tumor very well. The tumor is fairly ill-defined, so you don't know exactly the extent of the tumor, in which a breast MRI will give us a much better picture of what the tumor is in the breast, and also whether there are any other foci of tumor that we can overlook by mammography because the breast is very dense mammographically, and therefore we may miss something, both in the ipsilateral breast as well as the opposite breast. So when we do a breast MRI, we're not only checking the breast that will be operated, but we also check the other breast, and occasionally we may find something in the other breast that leads to a diagnosis of another smaller breast cancer that was overlooked on the original mammogram. There's also some other situations where breast MRI is very important. Those are, for example, patients that undergo preoperative chemotherapy, because we like to assess the extent of disease before, and then again repeating the breast MRI after completion of chemotherapy, giving us a better picture of the extent of disease after neoadjuvant chemotherapy, and helps us better to plan our lumpectomy. Another situation is patients that have an invasive lobular carcinoma that tends to be fairly mammographically occult and sonographically occult sometimes, but it enhances in breast by breast MRI. So these are patients that actually will use breast MRI much more commonly than the invasive ductal cancer patients. And lastly, there is a situation where the MRI is also very important, and that is when a patient presents with an enlarged axillary lymph node, but no evidence of cancer in the breast by mammography or ultrasound. You biopsy the lymph node and it says breast cancer, and then you are lost to find out where the primary tumor is in the breast, if you can ever find it. In these situations, a breast MRI will identify the primary tumor almost 80% of the time. So it's a very important test for what we call a patient who presents with axillary metastasis with an occult primary, mammographically and sonographically. For those patients, the next step is to get a breast MRI to identify potentially where the tumor is. And if you don't identify the tumor by MRI in these cases, sometimes the pathologist won't be able to identify it because it's a very small tumor somewhere in the breast that it escapes detection. Eventually, there's ways of treating these patients to make sure that they cover the breast either by having a mastectomy or by radiating the breast, even if you don't have a clue essentially where the tumor is. Now, the reason the breast MRI is not essentially a standard of care for every patient is that studies that evaluated MRI prospectively to see if it reduces the rate of positive margins, it reduces the reoperation rate after lumpectomy, or it improves disease-free survival or overall survival, we have not shown that MRI does this. But clearly, from a clinical standpoint, using MRI, we do often see additional tumors in the opposite breast or in the same breast that were overlooked, or sometimes we see that the extent of the disease is much higher, converting us to propose a mastectomy to the patient versus a lumpectomy. The downside of the MRI is that it's because it's very sensitive and sometimes picks up benign things that light up on MRI, and then forces us to work this further by either repeating an ultrasound or repeating the MRI and biopsy the area under MRI, only to find out that the lesion is benign. So obviously this is a downside, and of course MRI is costly. So if everybody had an MRI, then obviously the cost will really be much higher to take care of an early breast cancer patient. However, again, in the selected cases that I mentioned, the MRI could be very helpful in actually delineate the extent of disease, allows to do the appropriate surgery, and not to overlook additional foci of tumor in the breast, which obviously would be important to take care of upfront.